Welcome to Renes Care Radio. In this episode, we delve into a recent report from the Morbidity and Mortality Weekly Review, which highlights the rising rate of infections among patients in outpatient dialysis centers. The Morbidity and Mortality Weekly Review is a publication by the Centers for Disease Control and Prevention, CDC, in the United States. It's a vital source of information for public health professionals and anyone interested in tracking disease trends and outbreaks. This report specifically addresses the increased risk of bloodstream infections from Staphylococcus aureus in individuals undergoing dialysis for end-stage renal disease, underscoring the systemic issues and health disparities that exacerbate these risks. Patients on dialysis are about 100 times more likely to contract a Staphylococcus aureus bloodstream infection compared to those not on dialysis. The procedure itself is inherently vulnerable due to the exchange of blood, use of catheters, and the potential for equipment and water system contamination. Despite known infection control protocols, recurring deficiencies in adherence to these protocols have been identified in facility surveys, highlighting lapses in hand washing, changing protective wear, and equipment sanitation. The report also reveals alarming disparities in infection rates among different ethnic groups. Hispanic patients, for instance, were found to have a 40% higher risk of dialysis-related Staphylococcus aureus bloodstream infections than white patients. This discrepancy raises concerns about the quality of care and pre-dialysis health management in facilities servicing minority populations, who may face higher risks due to socioeconomic factors and reduced access to early and effective treatment options. Drawing on data from the CDC's 2020 National Healthcare Safety Network, the analysis covered 4,840 dialysis facilities that reported 14,822 bloodstream infections in 2020 alone. A significant portion of these infections were attributed to Staphylococcus aureus, a pathogen notoriously difficult to treat and a common cause of hospitalization among dialysis patients. The high prevalence of catheter use, especially among new dialysis patients and those requiring urgent care, is a major contributor to the risk of infection. Approximately 80% of new dialysis patients start with a catheter, which is strongly associated with higher infection rates. The study suggests a need for better pre-dialysis care and earlier vascular access planning to minimize dependence on catheters, which are known to have higher infection risks. In response to these findings, health organizations, including the American Medical Association and the American Society of Nephrology, in collaboration with the CDC, are developing educational modules aimed at improving infection control practices in outpatient dialysis centers. These efforts underscore the importance of adhering to infection prevention protocols and improving staff training to address the challenges unique to dialysis settings. The CDC report is a crucial wake-up call about the serious risks of infection in dialysis centers and the disparities affecting minority populations. It emphasizes the need for ongoing education, better healthcare access, and enhanced infection control practices to safeguard this vulnerable patient population. Addressing these issues is not only about following guidelines but also about ensuring equity in healthcare delivery and outcomes. Thank you again for joining us here on Renes Care Radio.